Kushi Kushalappa is the coordinator for the Collaborative Child Response Unit, CCRU project, Enfold Trust in Bangalore for the past 5 years. She works as a support person designated through CWC for children and families as they negotiate the perilous maze of police, doctors, courts, and society. She also trains police, doctors, and social workers on the processes in sexual assault cases. Welcome, Kushi.
When Enfold started working with the police in Karnataka, our work is a lot of our work has been in Karnataka. So our first impression was this fat guy who doesn't do nothing, who just hangs about, does police bandobast, etc. And then became this hero who's like, he's going to save all children who've been sexually abused. And now what we have is a realistic picture of a regular cop who tries to do what he can, given the environment, given the workload, the caseload with which they work. Just to give you an idea of caseload, in Karnataka itself, the sanctioned police force is 77,000 and the actual force is 57,000. There's a shortfall of 25%. But the shortfall of 25% gets compounded crazily because only 20% of the officers are actually available for investigation of crimes. The remaining officers or police personnel are there to issue summons, warrants, court duty, beat, bandobast, escort, and drivers. Whenever I do a session, a training program for cops, I always ask them, what would be a priority if the Prime Minister was coming and there was a murder case and there was a case of a child who was sexually assaulted? The immediate response is bandobast, because if he doesn't go for his bandobast duty, his head will roll tomorrow. So he needs to keep his job. His interest is in keeping his job, so therefore bandobast is priority, and then probably murder trial, and then murder investigation, followed by the child sexual assault. And also, apparently, the police are the least paid amongst all the government functionaries, compared to teachers, women and child development department, postal services, first division clerks. Yes, this is something that I just learned yesterday, to be honest. I was quite shocked to realize that the police were the least paid people. And we're constantly wondering, does anyone have something to say on that? Okay, we'll discuss this later. Considering that they are responsible for law and order and crime prevention, I would have thought they would be at least somewhere midway and not right at the bottom. Now, again, this is like preaching to the choir here. So I'm just going to run through this. The challenges that we have encountered: lack of sensitivity, extremely long drawn out investigations and trials, limited or no information on case status for child and family, extremely low conviction rate, lack of clarity on government services and schemes, resulting in an extremely low confidence in the society to report a crime, especially a crime of a child. If something were to happen to my daughter, I still don't know if I would have the guts to go up to the system and report it and say, file an FIR, because the system is extremely insensitive, undignified in the manner in which they manage cases. So this whole thing resulting in a lack of confidence in the criminal justice system and an extremely low percentage of reporting. So probable causes that we consider are lack of awareness of incidents of CSA, particularly interfamilial abuse in the society. Now, a cop is from the same thought process as our entire society, the judiciary, the doctors, etc., who find it extremely difficult to believe that a father can rape his own daughter or son, that an uncle would deliberately for the last 5 years be sexually assaulting their child. The cop is from the exact same society. It becomes hard for him in a very recent case that we handled, a white collar father who was accused of sexually abusing his two daughters who were 5 years of age. So after talking to us, to me and the mother, the investigating officer who was the was an inspector. He said, Madam, any change in his behavior in the last 6, 8 months? So the wife thought for a second and she said, no, not really. Madam, does he watch pornography? So she said, not that I know. What kind of work does he do? So she said, he earns about 4 lakh rupees. He works at an MNC. He's the global head of an MNC in Bangalore. And so he thought for a while and then he says, Madam, why do you think a guy like that would want to sexually abuse? If he wants, he can go out and get sex, he can buy sex. Why does he want to even, why would he consider, are you sure about this? This is the cop asking the mother. And rightly so, because he has never understood the dynamics of incestual abuse, familial abuse. No one has told him about this happening. The figures which Audrey gave earlier were really mind blowing, that 7.9% are fathers who are actually sexually assaulting their children. These are statistics that the cops need to be sitting here and listening. We all know all of this. The judges and the cops need to be here to hear this, for it to sink into them. All right, as usual, I digress. So, lack of causes, lack of awareness of incidents, particularly interfamilial abuse in our society, insufficient training of stakeholders, medical personnel, DCPU, CWC, social workers, prosecutors, and judiciary, no specialized teams and units managing cases. We have, last year, my colleague Dr. Shoiba Saldana was here and she spoke about the Collaborative Child Response Unit, which was a DWCD UNICEF initiative which Enfold sort of pushed through for about 2.5 years in Karnataka. Unfortunately, it was withdrawn at some point, where there was a team of trained medical personnel, police, not judiciary, sorry, they're two way up there for us to touch, a little bit of work with the prosecutors and some amount of work with the social workers in a unit, in a hospital-based unit, where when a child or a woman who had faced sexual violence was brought to the unit, there is a one-time interview of the child by all the stakeholders who are already there. There is a one-time medical examination by the pediatrics, the gynecology, the forensic doctor, everyone there, not sending the child for every single intervention to a different department in the hospital. So the Collaborative Child Response Unit was quite successful, and a similar model which is now part of the government scheme is the one-stop center. So not having specialized teams or units managing the cases is another possible cause. Lack of convergence between stakeholders, and this is something that I talk about wherever I get a chance. I think lack of convergence between stakeholders is a huge issue. It's not like the cops are not doing their job. It's not like the medical doctors are not doing their job. Given their environment and the pressure with which they work, they do something. They're not bad. But when they don't come together, cases cannot reach convictions. So, we thought that we would try and do some amount of training and sensitization of the police force. Now, we're talking about 57,000 police personnel across the state. Very, very difficult to reach out to that kind of number. But fortunately, I'm from a state where there has been sensitization of the police for the last 8 to 10 years. So you don't hear of police brutality as much as you might hear in other states. Karnataka is a tad better. I don't have figures. For the last 8 to 10 years, the police have been undergoing something called a gender sensitization police program, which was being driven by UNICEF, and it came under the training division of the police department. They trained the special juvenile police units, they trained child welfare officers, they regularly conduct monthly review meetings on all cases regarding related to children, like trafficking, CSA, etc. And specific challenging cases are discussed during the review meetings. And lately, what we have just introduced is a specialized training for child welfare officers. Now, Bangalore itself is divided into 7 zones. Bangalore Urban District is divided into 7 police zones. So, 7 police personnel from each of the 7 zones were nominated to attend a 3-day specialized training program, and they would be then the designated child welfare officers. So it was a 3-day, the duration was for 3 days. The topics that we trained them was on understanding sexual violence, dynamics and effects, particularly on incestual abuse, forensic interview methodology, medical examination, crime scene management, POCSO procedures, offences, rules, importance of convergence. Now, it's important for the police to know what kind of a medical examination needs to be conducted in a particular case. If the police believes that, okay, this assault, the investigating officer knows that the assault happened, let's say, a week ago. The child comes to the police station with the mother, the FIR is made, and immediately, typically, we are sent off to the medical facility, to the hospital. And there they will say, madam, rape case, investigation madi. Now, unless the police person tells the doctor who's investigating that this case occurred a week ago, conduct a medical examination accordingly. The doctor is going to conduct a routine medical examination, collect samples, swabs, clothing, even though they've been washed several times, the child has had a bath, all that is done. But as a routine, the cop knows that if it's a case of a penetrative assault, the child has to immediately be sent for a medical examination. And these are all the typical things that we look out for. But like Sangeeta was saying, we don't look out for things like the use of lubricant, the use of a condom. So these are all the things which were highlighted during the training. And we had some interesting people who came and did the training. We had staff of the Forensic Science Laboratory. Luckily, in Karnataka and Bangalore, we have a Forensic Science Laboratory, which is a state-appointed one, which comes under the Department of Home. So the police have some amount of rapport with them. We got people from the FSL to come. We had doctors come. We had forensic experts, police officers, and legal experts, all part of the training. So everybody brought their knowledge to the table, and there was interesting active discussions. Methodology used for the training was case analysis and discussions, interactive sessions, role plays, convergent sessions with stakeholders. Again, we were quite reluctant about doing role plays with cops, thinking that, my God, what are cops going to do with role plays? But they were quite enthusiastic. They are willing to learn. They are eager to learn. They want to be trained. Now, whether that converts to fantastic investigation on the ground is yet to be seen. But at least as a step, they are eager to learn. They are willing to be trained. Following the 3-day training program that we did, the training program was in March. In May, we conducted a study of Bangalore city police stations. We have about 106 police stations in Bangalore. We wanted to understand POCSO awareness amongst general staff in a police station, not just the child welfare officers. So there were 55 police stations that we approached, of which we had 145 police officers. Police officers starting from constabulary right up to the inspector level. So you can see the participation in terms of where the zones of the police and the kind of staff that we had. So we had inspectors, we had sub-inspectors, we had women assistant sub-inspectors, we had constables, the entire range of them. And some of the questions that this is just a few of the questions that we had mentioned, we had asked the police of, how did you hear of POCSO Act? How many POCSO cases have been reported at the station? Have you ever handled a case under POCSO? Have you attended POCSO training? How do you do you need more information about POCSO? Besides POCSO, we also wanted a little bit about their beliefs and attitudes. Do you think that everybody needs to be trained about the act? Does CSA happen more to girls than boys? Is CSA more prevalent in poor families than in rich families? Can a woman sexually abuse a child? So it was a mixed questionnaire, and the responses that came were quite interesting. So all participating police officers requested for additional training on the act itself. 70% of the personnel had not attended any training on POCSO, which was expected, but it was good to have a figure, especially the senior officers. Now the shame is that the senior officers, who invariably end up being the investigating officer in a heinous crime under POCSO, for example, so an inspector upwards, ACPs, don't have very much training or knowledge on POCSO. So then they depend on the sub-inspectors, the assistant sub-inspectors to provide them information, which can be quite biased, prejudiced, etc. 67% of the officers had not handled a POCSO case. Yet 100% of officers and 90% of constables had heard of the act. 90% of personnel believe that girls are sexually abused more than boys. And this is something at every single training program, whether it's CWC, DCPO, students, police, anywhere we go, the impression that people have is that girls are much more abused than boys are. Uh, and I think it's going to take a very long time for general public to believe that in India boys are more sexually abused than girls are. 56% of the police personnel believe that child sexual abuse is more prevalent in poor households. So this is just a sort of a synopsis of the study. The details of the study are available with us. If anyone is interested, we'd be happy to share them. So, following the first training, we did the study. Following the study, since it came out that the senior officers need to be requested for more training, we approached the commissionerate, again quite enthusiastic and cooperative, and we told him that we'd like to start training inspectors and ACPs zone wise in the city to start with, and then take it down to the districts. So at this point, they have agreed to have an initial round of training for inspectors and ACPs in Bangalore urban. The dates are yet to be confirmed. We had a whole bunch of transfers in the police department lately, and the training and sensitization to be on a ongoing basis, as they constantly being transferred. So while we would get very disappointed when we when we train these 49 staff, and already a few of them are no longer in those running those doing those roles for which they were trained for, um, it's still okay, because wherever they are, whichever police station they are at, they at least have some amount of sensitization training knowledge, or at least a phone call away they know that they can reach out to somebody who can probably give them more information. uh, while that is a good thing, it continuously there needs to be training and sensitization of the police. Yeah, so urgent need for systematic training on dynamics of abuse, particularly incestual abuse, forensic interviewing, specialized investigations of crimes of sexual violence, and not just POCSO Act and procedures. Convergent training to interact with doctors, CWC, social workers, NGOs, prosecutors, judiciary, and forensic experts. Um, the police often tell us that they don't get support from the other departments. When they go to a when they take a case to a hospital, there is very little that they can tell the doctor. I mean, I can stand here and tell the cop that you have to tell the doctor that the assault happened 4 days ago, or a week ago, or a month ago, so don't collect samples and swabs. It's okay for me to tell the police guy, but the police guy is not in a position to tell the attending doctor that this is a case that happened 4 days ago. Do your investigation and form your medical opinion accordingly. That space is not available to the police at all. The doctors are unwilling to uh, sort of accommodate, or even give them a hearing as to what the background of the case would be. It would be a routine case. The same case that I referred to earlier, where the mother filed a case against her husband for sexually abusing her two children. Um, the police said we can take the children to a hospital which was very close by, and this was a fancy five-star hospital. I walked into it was about 8 o'clock in the evening. In this particular case, the police were fantastic in their response in terms of not asking the children to come to the station. Just the mother and me went to the police station, and we met the IO, and he said, just bring the children over at to the hospital at 7 o'clock. We were a little reluctant to bring the kids over at 7 o'clock, but he said, if you don't, the defense lawyer is going to turn the case around on us and say, why didn't you insist on a medical immediately? They could have planted evidence subsequently, etc. So we said, fine, we'll take the children to the hospital. So we went to this five-star hospital in Bangalore, where I would have thought they were extremely familiar with medico legal procedures, the medico legal guidelines, because these are doctors who have definitely worked abroad in UK systems, US systems, who have some sort of information on what kind of samples to collect, what kind of questions to ask the child, I was quite disappointed. It was very strange when I walked into the hospital. The attending doctor, who was a very senior doctor, and everyone was kind of bustling around her, it turned out she was a very good friend's sister. So I walked up to the doc and said, "Hey, I'm so glad to see that you're here, and you'll take care of everything, right?" She said, "Yeah, yeah, absolutely. What's the history of the case?" So I said, "It's a case of the father fondling the two daughters. So there has not been penetrative sexual assault, at least as far as we are aware." She said, "Oh, really? But I have to collect samples and swabs." I said, "I'm asking you on a personal level now. Forget what you have to do, your legal responsibility to the hospital. There is absolutely no point in collecting samples and smears because you know for a fact is going to come negative. And the case, like everyone says, the cases are pegged so heavily on the medical evidence. The minute there is no medical evidence, it becomes very easy for the judiciary to say, no, acquittal." Um, I was unable to convince this very, very close friend's sister who has come to my house and eaten a meal that there was no need to collect samples of this child, and all you needed to do was probably talk to the child, conduct a forensic interview with the child, document what they say in a very friendly environment rather than collecting swabs. But I couldn't get across to her. So this whole thing about convergence becomes important because there needs to be dialogue between the stakeholders for each to understand where one stakeholder's role ends and the other one begins. There are a lot of egos and everything that come in the way of our case management at this point, and I think it's time to set that aside and get together and work as a team rather than I'm from the police department, I'm from CWC, and I'm from the medical fraternity, and no one can tell each other how to do things. And that's where I end.